You're in the bathroom. You look down, and there it is, a small, clear drop at the tip of your penis. You didn't ejaculate, you didn't even feel it happening, and suddenly your mind races. Is something wrong with me? Do I have an infection? Should I see a doctor? Maybe you've noticed this happening more often lately. Maybe it's been going on for years, and you've just been too embarrassed to bring it up. Maybe you've searched online at 2 in the morning, hoping to find answers without having to ask anyone face to face. You're not alone. In fact, this is one of the most common concerns men have about their bodies, yet it's rarely discussed openly. Here's what nobody told you growing up, and what most men are too embarrassed to ask their doctors. That clear fluid might be completely, totally normal. But here's the problem. Sometimes it's not normal. And the difference between the two could mean the difference between peace of mind and a serious health issue that needs immediate attention. Today, I'm going to explain exactly what's happening inside your body, why this fluid exists, when you should relax, and when you absolutely need to take action. Stay with me, because by the end of this video, you'll finally understand something that affects every man, yet almost no one talks about. You'll have the knowledge to recognize what's normal, what's not, and exactly what steps to take if something seems off. Let's start with the basics. That clear, slippery fluid you may notice during arousal is called pre-ejaculatory fluid, or what most people call pre-cum. And here's the first thing I want you to understand. It's not the same as semen. Not even close. Semen is the thick, whitish fluid that contains sperm and is released during ejaculation. Pre-ejaculate is something entirely different. It's produced by completely different glands, has a different composition, and serves a completely different purpose in your body. Pre-ejaculate comes from two small glands called the Cowper's glands, also known as the bulbourethral glands. These pea-sized glands sit just below your prostate, tucked away on either side of your urethra. They're completely separate from the testicles and prostate that produce semen. These glands were first described by an English anatomist named William Cowper back in the 17th century. For over 300 years, scientists have studied what these tiny glands do and why they're so important for male reproductive health. The amount of pre-ejaculate varies dramatically between men. Some produce just a few drops, barely noticeable. Others can produce up to 4 or 5 milliliters, enough to be quite visible and sometimes even concerning. And here's something interesting. You can't feel it coming out. There's no sensation, no control, no warning. It simply happens automatically when you become aroused. This is because the release of pre-ejaculate is controlled by your autonomic nervous system, the same system that controls your heart rate, digestion, and breathing. You have no conscious control over it, just like you can't consciously control your heartbeat. Now you might be thinking, why does my body even make this stuff? Great question. Your body is incredibly intelligent, and pre-ejaculate serves 3 critical purposes that most men never learn about. First, it's a biological cleanup crew. Your urethra, the tube that runs through your penis, carries both urine and semen. These two fluids share the same exit pathway. The problem? Urine is acidic, with a pH typically between 5 and 6. And sperm cells? They cannot survive in an acidic environment. Even brief exposure to acidic conditions can damage or kill sperm cells. So before ejaculation, your body releases this alkaline fluid to neutralize the acid and clear the pathway. The pre-ejaculate has a pH of around 7 to 8, which helps create a more hospitable environment. Think of it as rolling out the red carpet for sperm. Your body is literally preparing the pathway to give sperm the best possible chance of survival. Second, it's nature's lubricant. Pre-ejaculate contains special proteins called glycoproteins and mucus that create a slippery texture. This provides natural lubrication during intimacy, reducing friction and making sexual activity more comfortable for both partners. This lubrication also helps protect the sensitive tissues of the urethra during sexual activity. Without this natural lubrication, there would be more friction, more potential for micro-tears, and more discomfort. Third, it protects sperm survival during reproduction. The vaginal environment is also naturally acidic. typically with a pH between 3.8 and 4.5. This acidity is designed to protect against harmful bacteria and infections, but it also poses a challenge for sperm, which thrive in more neutral or slightly alkaline conditions. Pre-ejaculate helps create a buffer zone that gives sperm a fighting chance to survive their journey. It's like sending an advance team ahead of the main troops to prepare the battlefield. So if you've ever wondered why this happens, now you know. Your body is preparing for reproduction, even if that's not your intention. It's an automatic biological response that has evolved over millions of years. Now here's where we need to get serious. Not all penile discharge is pre-ejaculate, and being able to tell the difference could save you from a potentially serious health problem. This is information that could literally change your life or even save it. Normal discharge looks like this: clear or slightly translucent, like water or very light mucus. It occurs during or shortly after sexual arousal, whether from physical stimulation, visual stimulation, or even just sexual thoughts. There's no strong or unusual smell, maybe a very faint, slightly salty odor, but nothing unpleasant. No pain, burning, or discomfort accompanies it, and it doesn't persist throughout the day. Once arousal subsides, the discharge stops. Abnormal discharge, discharge that should concern you, has these characteristics: yellow, green, gray, or blood-tinged color. Any color other than clear or slightly whitish should raise a red flag. A foul, fishy, or unusually strong odor. Thick, clumpy, or pus-like texture. Discharge that occurs without any sexual arousal whatsoever. Burning, stinging, or pain during urination. Discharge that leaves noticeable stains on your underwear throughout the day, or symptoms that persist for more than a day or two. If you're experiencing any of these warning signs, please don't ignore them. I cannot stress this enough. These could indicate infections like chlamydia, gonorrhea, trichomoniasis, mycoplasma, or other conditions that require medical attention. Let me tell you something I've seen too many times in my practice. Men come in after weeks or even months of ignoring symptoms because they were embarrassed or hoped the problem would go away on its own. By then, what could have been a simple course of antibiotics has become a more complicated situation. Early detection and treatment of infections prevents serious complications like epididymitis, prostatitis, urethral strictures, and even fertility problems. Don't let embarrassment put your health at risk. Now, let's address one of the biggest questions I hear in my practice. Can pre-cum get someone pregnant? The honest answer? Yes, it can. I know this might surprise some of you. There's a common misconception that pre-ejaculate doesn't contain sperm. For years, even some medical professionals believed this. But modern research has shown us a different picture. Here's what the research shows. Studies have found that approximately 40% of men have sperm present in their pre-ejaculatory fluid. And here's the surprising part. Some men always have sperm in their pre-cum, while others never do. This appears to be consistent for each individual. Scientists believe this always or never pattern might explain why the withdrawal method works for some couples and fails dramatically for others. If you happen to be someone who always has sperm in your pre-ejaculate, the withdrawal method will never be reliable for you, no matter how careful you are with timing. What about urinating beforehand to flush out leftover sperm from previous ejaculations? Unfortunately, research shows this doesn't reliably work. Sperm can still appear in pre-ejaculate even after urinating multiple times. The sperm found in pre-ejaculate may actually be freshly produced rather than leftovers, though scientists are still studying this. The bottom line: if pregnancy prevention is your goal, do not rely on the withdrawal method alone. The typical use failure rate is around 20%, meaning roughly 1 in 5 couples using this method will experience an unintended pregnancy within a year. The risk is simply too high when more reliable options are available. There's another critical point I need to make, and I want you to pay close attention to this. Pre-ejaculate can transmit sexually transmitted infections, including HIV, chlamydia, gonorrhea, herpes, and hepatitis B. While the viral or bacterial concentration in pre-cum may be lower than in semen, transmission can absolutely occur. Studies have detected HIV in the pre-ejaculatory fluid of infected men. This means that even without ejaculation, transmission of serious infections is possible. This is why using protection from the very first moment of genital contact, not just before ejaculation, is so important. Many people make the mistake of thinking that protection is only necessary right before climax. This is a dangerous misconception that puts both partners at risk. If you're with a new partner or in a non-monogamous relationship, consistent protection throughout the entire sexual encounter is essential for your health and your partner's health. So when should you actually be concerned? When should you pick up the phone and make an appointment? See a doctor if you experience discharge that appears without any sexual arousal, any discharge that's yellow, green, cloudy, or blood-tinged, pain or burning during urination, even if it's mild, testicular pain, swelling, or tenderness, a foul or unusual smell from the discharge, any symptoms appearing after unprotected sexual contact with a new partner, discharge that persists for more than a few days, itching or irritation around the urethral opening, or any discharge accompanied by fever, chills, or general feelings of being unwell. Modern STI testing is quick, confidential, and often just requires a simple urine sample. Gone are the days of uncomfortable swabs for most routine testing. Many clinics offer rapid testing with results available within hours or days. There's no reason to feel embarrassed. We see these concerns every single day, literally every single day. You would not believe how common these questions are. And getting tested is one of the most responsible things you can do for yourself and your partners. It shows maturity and respect for everyone's health. Before I wrap up, let me address something that many men feel uncomfortable discussing, even with their doctors. Some men produce significantly more pre-ejaculate than average. We're talking about amounts that can soak through underwear and even outer clothing during arousal, which can be socially embarrassing and cause significant anxiety. I've had patients tell me they avoid dating or intimate situations because they're worried about this. They feel like something is wrong with them. They feel isolated and ashamed. Here's what I want you to know. Excessive pre-ejaculate is not dangerous. It's not a sign of disease. It's not a sign of sexual dysfunction. It's simply a variation in how your body works, just like some people sweat more than others, or some people produce more saliva. The amount of pre-ejaculate you produce is largely determined by genetics and hormone levels. It's not something you did wrong, and it's not something you can control through willpower or lifestyle changes. However, if the amount is affecting your quality of life, if it's causing you to avoid social situations, intimate relationships, or if it's simply making you miserable, there are medical options available. Medications like finasteride, which affects hormone metabolism, can help reduce production in some men. Other medications that affect the autonomic nervous system may also be helpful. If this concerns you, talk to your doctor. It's a more common conversation than you might think, and there's no need to suffer in silence. I also want to mention something that doesn't get discussed enough: the psychological impact of concerns about your body. Many men experience significant anxiety about penile discharge, whether it's worrying that normal pre-ejaculate is a sign of disease, or feeling embarrassed about the amount they produce, or fearing judgment from partners. This anxiety is real and valid, but I want you to know that understanding your body better, which is exactly what we've done today, is the first step toward peace of mind. Knowledge replaces fear with understanding. And if you're still struggling with anxiety about these issues, talking to a mental health professional can be incredibly helpful. Your mental health is just as important as your physical health. Don't neglect either one. So let's bring it all together. That clear fluid during arousal? In most cases, it's completely normal. It's your body doing exactly what it's designed to do, preparing for reproduction, providing lubrication, and protecting sperm. It's a sign that your body is functioning as it should. But now you know the warning signs. You know what abnormal discharge looks like. You know when to seek help. You know the risks associated with pre-ejaculate regarding pregnancy and STI transmission. And you know that if the amount you produce is affecting your quality of life, there are options available. Knowledge is power, and when it comes to your health, especially something as personal as this, you deserve to understand what's happening in your own body. You deserve to make informed decisions. You deserve peace of mind. Don't let embarrassment keep you from taking care of yourself. Don't let stigma prevent you from asking questions. And don't let misinformation lead you to unnecessary worry, or worse, to ignoring symptoms that need attention. If this video helped you, please give it a thumbs up. It really does help more people find this information. Share it with a friend, a brother, a son, someone who might be too embarrassed to search for this themselves. You could be helping someone who really needs this knowledge. And subscribe to the channel because I'll continue bringing you honest, medically accurate information about the topics nobody else wants to discuss. We'll tackle the uncomfortable questions, break down the complex medical concepts, and give you the information you need to take control of your health. Your health matters. Your questions are valid, and you deserve real answers. Don't be afraid to take care of yourself. Don't be afraid to see a doctor when something concerns you, and don't be afraid to advocate for your own well-being. I'll see you in the next video. Take care of yourselves.